How does estrogen contribute to BPH? Imagine your prostate as a busy factory that changes as you age. One of the key players in these changes is estrogen, a hormone often associated with women but also present in men. As men grow older, their testosterone levels tend to decline, but estrogen levels stay the same or may even slightly increase. This shift causes the balance between these hormones to tip, leading to a higher estrogen to androgen ratio in the prostate. This imbalance can stimulate the prostate cells to grow more than usual, contributing to benign prostatic hyperplasia, or BPH. Estrogen works by binding to specific receptors in the prostate tissue called estrogen receptors. The main types are estrogen receptor alpha, estrogen receptor beta, and the G-protein coupled estrogen receptor. When estrogen attaches to these receptors, it influences gene activity and cell behavior. Estrogen receptor alpha is often linked to cell growth and inflammation, which can promote prostate enlargement. Meanwhile, estrogen receptor beta might have some protective effects, but the overall impact of estrogen binding to these receptors tends to favor tissue growth. Recent studies also show that estrogen can promote fibrosis in the prostate. Fibrosis is the buildup of fibrous tissue, which makes the prostate stiffer and can worsen symptoms of BPH. This process involves estrogen activating certain signaling pathways in the stromal cells of the prostate, leading to more connective tissue and structural changes. Estrogen doesn't act alone in this process. It works together with androgens, the male hormones like testosterone. Research in animals shows that when both estrogen and androgens are present, they can work synergistically to cause more significant prostate growth than either hormone alone. This means estrogen can enhance the effects of testosterone, making the prostate enlarge and become more inflamed, which are common features of BPH. Understanding how estrogen influences prostate growth has opened the door to exploring new treatment options. Scientists are investigating drugs called selective estrogen receptor modulators, which can target these receptors to potentially slow down or reduce prostate enlargement. However, these treatments are still under study, and more research is needed to determine their safety and effectiveness. In summary, estrogen contributes to BPH by disrupting the hormonal balance in the prostate, activating specific receptors that promote cell growth and fibrosis, and working alongside androgens to accelerate prostate enlargement. Recognizing these mechanisms helps us understand the complex hormonal regulation of the prostate and guides future therapies. If you're concerned about prostate health or BPH, it's always best to consult a healthcare professional for personalized advice and treatment options.